consulting firm with Akindele Okpeyemi, powered by Center for the Advancement of Pharmacy Practice.
Hello everyone. My name is Akindele Okpeyemi and this is Consulting Firm Video. Don't forget, this channel, I've created it to curate resources, free resources for pharmacists, for professional development, and also for employers of pharmacists to have a resource they can always bank on for training their staffs. Not everybody has got the time, not everybody has got the skills to pass across knowledge in a very simple and clear manner. So today I'll be talking about malaria test negative. A lot of pharmacists out there are embarrassed when they see patients with all the classical signs and symptoms of malaria: fever, chills, headache, general malaise, and then their results came out as negative. They are like, wow, but this person shows all the signs and symptoms of malaria, but the test kit, the malaria rapid diagnostic test kit, is saying it's negative. So what do? I know many times a lot of you out there as pharmacists, you feel embarrassed. There are times people just write positive or trace. But what is the truth? The truth is you should record negative as negative, but then not without some explanations and what you can do. So these are the issues, right? Malaria test negative and patient has all the signs and symptoms: chills, fever, general malaise. So what do? How do we explain it? Now, the first thing here is dose response curve. Every single kit that is used for rapid diagnostics, they have what we call threshold. They have detectable limits. Okay, so if the parasitemia, the concentration of parasite in the bloodstream, if it's not up to the detectable limit of that particular RDT, it's going to come out as a negative. We will call that false negative. All right, so what we are testing for, the most common RDTs for malaria are testing for HRP2, histidine-rich protein 2, produced by Plasmodium falciparum. So once it's below detectable limit, it might come out as negative, even though the person actually has malaria parasite in their bloodstream. High response and high stress level and low immunity. There are times people succumb to malaria even though the parasitemia is below detectable limit. So when the stress level of a person is high, for example, change of environment can result in high stress level, preparing for examinations, anxieties, and some other factors, or getting on a new job. These are circumstances that will increase stress level for a patient, right? So when that happens, the body produces a lot of cortisol, and that drives down the strength of the immune system. So what happens? Low level of malaria parasite in the blood that should ordinarily not have caused signs and symptoms will give them these symptoms: chills, fever, malaise. Okay, so that will explain why sometimes a person might have negative malaria test results, even though they have the signs and symptoms of malaria. The third one is treatment failure. So you need to do a lot of clerking and be strategic about how you ask your questions. Okay, there are times that, as you can see, treatment failure from what? Suboptimal dosing. That can cause a negative result. So there are times people would have taken, for instance, imagine adults taking 240 strength of artemether lumefantrine, and then they said, oh, I used a few tablets some days ago and I'm still having chills and I'm still having fever. When you test them for malaria, the result might come out negative because the little they have taken might have driven the parasitemia below detectable limits, even though the person has not actually experienced clinical cure or microbiological cure, as the case may be. So that could be a cause. Number 4 is treatment failure arising not from suboptimal dosing now, but from what? Resistance. Resistance is a big issue, compounding or confounding our expectations when we treat patients for malaria. So a lot of people now come down, the reports of resistance continue to increase year on year, and that will explain why. So for instance, somebody has taken a particular brand of anti-malaria and then they soon relapse, or they did not even improve, their health condition did not really improve even after taking standard dosage of artemisinin based combination therapy. But when their blood is tested for malaria, it might come out negative. Sometimes it comes out positive still, but don't forget, I'm telling you why malaria test may come out negative, even though the person is having the main signs and symptoms of malaria. So when there's resistance, standard dosage has been taken at the appropriate time with the appropriate way. You have crossed your T's and dotted your I's, but the person still have classical symptoms of malaria. That is very, very possible when and if there's resistance to that particular molecule. Okay, now the other explanation could be that, okay, maybe there are other species of malaria parasites involved beyond Plasmodium falciparum. The test kit that we generally use in this part of the world is basically designed to detect HRP2 of Plasmodium falciparum and not that of ovale or that of malaria or vivax. Okay, so sometimes you might suspect, but also depending on travel history, where the prevalence of ovale, malaria or vivax, where their prevalence is high, right? So that could be an explanation for a negative malaria test result where the patient has the classical symptoms of malaria. Okay, so what skills do you need? What skills? The skills you need are: 1, proper history taking. Proper what? History taking. So like I said, once history is taken, as you have it here, in terms of stress level, in terms of if the person had taken malaria medications, for instance, in the last 14 days, then you want to see if it could be a case of resistance, if it could be a case of suboptimal dosing causing treatment failure. So we need to understand history taking. And don't forget, you can combine testing, okay, that is objective, and empiric treatment or history taking, which is subjective. There is nothing bad in assessing a client and concluding if the person has malaria. You can check the standard treatment guideline or national policy on malaria treatment. It's endemic in this part of the world. So most of the people that present with fever, likely, the likelihood is high that they actually have malaria. There's nothing bad in actually assessing someone and trying to judge if the person truly has malaria. But to move the practice forward and to increase the confidence people have in us, we need to test. But testing alone is not the testing alone does not work. You have to combine it with your clinical experience, with your understanding of the disease trend or pattern in your environment. So the two have to be combined. So you need that skill, okay? And also, just to share with you an experience I had, I'm not generalizing it, where we treated someone and the person still tested positive, for instance, for malaria. And then, of course, the person could afford it, so we continued testing on another, after using another antimalarial, then we tested again until Syrian by Rambaxi was used, antimalarial piperaquine, and then we tested again and it was negative. Okay, even though all the while the person was clinically fine, no complaints, no symptoms, but then the test is showing that the parasitemia was still high until we use that particular molecule. So malaria treatment, it could be challenging at times, but then to help your clients or patients, you have to bring a lot of skills to bear. So when someone has tested negative, what you do is to treat. If you find out the person has the classical symptoms of malaria, okay, even for pediatric patients, you wonder at times why you think they falsify figures when they tell you hundreds of thousands of children die from malaria in sub-Saharan Africa. Part of the problem is because once the practitioner relies solely on testing and the little boy or little girl tested negative, they keep finding what is not lost, and before they know it, the child is dead. So according to the WHO, you should still treat for malaria, even if at the end of the day the person treated does not actually have malaria. You have done no harm. You have done no harm, because most likely the chances are the person has malaria, and malaria drugs do not harm, will not cause any harm if used, even though the person has not tested positive for malaria. So the guideline says treat, right? Treat, then look for other possible causes of fever or chills or fatigue, as the case may be. So you have to use your ACT in whatever combination, okay? And if the symptoms persist, you refer. That's what you do. You refer to a clinician that has more knowledge or more expertise around that particular area. So use your ACT, SP plus what? Artesunate, okay? Yes. Or artemether, lumefantrine. You know all those stuff. Modiaquine and what? Artesunate, dihydroartemisinin plus piperaquine. Okay, there are a lot of products out there that you can use when someone tests positive, negative for malaria, but shows classical symptoms of malaria.
Consulting firm with Akindele Okpeyemi, powered by Center for the Advancement of Pharmacy Practice.
Okay, so just to go over what all I've been talking about ever since, I said never ever feel embarrassed. Okay, write negative as negative, but then there are certain ways to explain why that will happen, where the client have or is showing classical symptoms of malaria. And when that happens and you have carefully looked at, this dose response curve is just to explain to you why a test result might be negative. Anyway, the parasitemia is not high enough. But these are actual explanations why some may test negative before malaria. If their stress level is so high, then the immune system has reduced such that slight parasitemia that should not ordinarily have given them symptoms or cause them symptoms, is now causing the symptoms. It could be due to treatment failure. A malaria treatment has been partially used, but it has only cleared the parasitemia below detectable limits, but not complete eradication. Or treatment failure arising from resistance, and you can only conclude with resistance if only standard treatment has been used and everything that should be done has been done, but then the person still succumb to malaria. Their health is not improving. It could also be as a result of other species of plasmodium that the regular duties we have for malaria will not be able to detect. Okay, so thank you for watching. You can share this video to as many platforms as possible. Subscribe to our channel. Until next time, when I bring you another fantastic topic that can be of use for you in your practice. I remain Akinlele Okweyemi, and this is Consulting Farm Video. Thank you. See you. Who is there?
Consulting Farm with Akindele Okweyemi, powered by Center for the Advancement of Pharmacy Practice.